I want to welcome on our show internationally renowned interventional pulmonologist with over 2 decades of experience, Dr. Vivek Nangia, who's also the Chief of Pulmonology at Max Healthcare. Sir, as we thank you for being with us, this is a situation, sir, that we're trying to actually look at. What is HMPV? How do we treat it, sir? And also, how can we diagnose it?
This is not a new virus for us. We've known about it since 2001 when it was first detected in Netherlands. Since then, we've been seeing it every winters. Practically, it is said that by the time a child achieves the age of 5 years, the child has already been exposed to this virus, if at least once or twice. And this virus basically affects children less than 5 years of age, elders more than 65 years of age, and then people who are immunocompromised, like those who are on immunosuppressive therapies, chemotherapies, steroids, those who have HIV or any other illness which causes their immunity to go down. It's also seen more commonly in patients with asthma and chronic obstructive pulmonary disease. Unfortunately, there is no specific treatment for it. It's only symptomatic treatment that you have to follow in these patients.
So, Dr. Nangia, how is HMPV diagnosed, and is there a test that can be done? Can you get HMPV twice?
So HMPV is a viral infection, as I said. It's a virus itself. So it can be diagnosed with a test called reverse transcriptase polymerase chain reaction, or RT-PCR, exactly similar to what we used to do for our COVID patients also. And there's also another immunofluorescence test that can be used, but RT-PCR is a more confirmatory test. And as far as two episodes are concerned, it's unlikely that immediately within a short span you can have two episodes. Of course, you have one episode now and one episode in the next season. That definitely is possible.
Dr. Nangia, is there a vaccine for human metapneumovirus?
Unfortunately, not again. There is no vaccine yet. Therefore, it is important for us to follow the standard precaution that we used to follow for COVID, which include safe distancing, hand hygiene, cough etiquettes, staying at home if you have a cough and cold. This is something very important that I tell all my patients. When you have cough and cold, first 3-4 days, you should just confine yourself to home. Probably take a teleconsult rather than coming to the hospital straight away. Keep monitoring your oxygen levels and fever. If in 3 days or 4 days there's no abatement in fever and the oxygen levels are dropping anytime, then you should be seeking medical help. Until then, just keep yourself warm, take paracetamol to bring down your fever, keep yourself well hydrated and well protected.
Dr. Nangia, then there are these cases are spreading across India. I'm just seeing there are 2 cases in Karnataka, 2 cases in Maharashtra, 2 in Tamil Nadu, Gujarat, and West Bengal have 1 case each. What are the symptoms? They say the common symptoms could be cough, but the severe symptoms that one has to watch out for.
So, like any other respiratory virus, the most common symptoms are cold, cough, sore throat, body aches, fever when it's restricted to the upper respiratory tract. When it goes down into the lungs, then it can cause breathlessness. Of course, cough and fever can still be there, chest pain. Some people can even have blood in their sputum. So these are the common symptoms. But what you need to watch out for is an increase in the respiratory rate. If the respiration is becoming labored, if the oxygen levels are dropping, blood pressure is dropping, temperature is not abating, that is the time you should be seeking medical help immediately.
And Dr. Nangia, how can this be transmitted?
So again, this is one of those viruses which are transmitted through the droplet infection, just the same way that COVID was transmitted. Droplet would be transmitted when you're coughing, when you're sneezing, when you're talking, when you're laughing in front of people. When you come in contact with something which already has the virus on it, like the fomites as we call them, like tables, door handles, and all of that. And then of course, when you shake hands with somebody who's carrying the virus in their hands. So hand hygiene is extremely important in these situations.
So I will ask you a separate question on what precautions India needs to take. But is this an alarm for India? Is it going to be like a COVID-like situation and panic? What should India be doing as such?
So not yet. It is not an alarming situation right now because in any case during the season we do get such patients. So most patients have an upper respiratory involvement only and the disease is mild. It's only some who land up in a hospital with a pneumonia-like picture and very few mortalities that occur because of this virus. So while I'm saying that we needn't be in a state of panic, but we certainly need to be in a state of caution where we cannot be caught being complacent or being off guard. So we need to be vigilant. We need to keep a watch, follow all the precautions, but not at the same time panic.
Right. And my last question, Dr. Nangia, what are the precautions that we need to take? We have to wash our hands well, but what is the cough etiquette? What are the other precautions that we need to take?
Right. So the standard precaution that you would follow for COVID, if you remember, I mean, it's like a recall of those days again, where you would follow a safe distance from people, 3 meters different distance. You would wear a mask. N95 mask would be preferable in this situation. Cough etiquettes are when you have to cough, then you cough into the upper part of your arm, or you take out a tissue paper or a hanky. Tissue paper can be discarded right away, but not that you should be sneezing or coughing openly like this. So it has to be a covered kind of a cough. And then again, as I said, in the first few days of your cold, cough, fever, stay at home, stay isolated, irrespective of your diagnosis, even if it is flu, COVID, metapneumovirus, RSV, any of these viruses, it's best to stay isolated and not transmit it to others. Hand hygiene, of course, if you have soap and water access, that's the best thing. If not, then at least with the chlorhexidine hand washes that I'm sure are now available rampantly across every store, every part of the country, they're easily available. So we should be using those and avoiding going to overcrowded places. These days there are lots of parties also happening. Winter time is when you have parties during the day, during the night. So you should avoid huddling up in small groups. But then again, yes, if the party is in the open air and there are not too much of overcrowding, then of course you could be attending them. People who are immunocompromised, those who have underlying asthma or chronic obstructive pulmonary disease, they should ensure that the diseases are well controlled, well managed. So not that their symptoms are partially treated, they're not on proper treatment. So all that needs to be done, and I think there's no harm in getting the flu shot at least. If nothing else, it'll protect you from flu. So flu also reduces your immunity, and there's always chance of co-infection of other viruses also that can happen.
Yes, thank you, Dr. Nangia, because we've got a sense of what needs to be done. Viewers, it's also time to get a flu shot. Thank you.
Thank you.